So the effect of tobacco use on the population's general health already illustrated, and we all know, as we are involved in this deeply, the consequences on general health and especially of oral health. And as it was mentioned in the World Health Report 2013, that all health providers must be involved in the treatment of tobacco dependence, including oral health professionals, who in many countries reach a large proportion of the healthy population. Today, the statement, the first speaker will be Francisco Lozano, the ENSP president, will introduce the 2021 ENSP Working Group Position Statement on Oral Health and Tobacco and New Nicotine Containing Products. Dr. Lozano, he held many positions, senior positions in the past, and currently he is the ENSP president. So, Dr. Lozano, the floor is yours.
Thank you very much, Hani. Let me share. Share my presentation. Well, thank you very much, Hani. Welcome to this webinar to all of you. Thank you especially to all the members of the group, because you are the authors of this statement that we are presenting today. I will start saying some words about ENSP. Let me put this, sorry. Okay, yes. Well, ENSP is the European Network for Smoking and Tobacco Prevention. We are 77 members from 38 countries, 22 European Union members and 16 non-European Union, but of course in the WHO European region. The important thing is that we cover approximately 750 million people. That's important for me. And let me say something about why we started with this group. Well, I'm a dentist, like most of you, and I was the General Secretary of the Spanish Dental Association time ago, and I was in charge of organizing a very interesting oral cancer campaign on prevention and early detection of oral cancer. It was a campaign that for several years was run by the Spanish Ministry of Health and the Spanish Dental Association. And I realized that behind almost all cases of oral cancer, it was tobacco. And then I was very interested in tobacco. I enrolled myself in a master's degree in tobacco control and tobacco dependence and treatment in the university. That was the year 2005. And for my surprise, I was the first dentist that registered in this master. But I can tell you that 16 years later, I'm professor of that master, and only another 2 dentists have registered in this master of the University of Cantabria and University Complutense of Madrid. And more than 400 health professionals have been in these years, have passed through this master. Well, I was representing the Spanish Dental Association in the National Committee on Tobacco Prevention. That is a committee very important in Spain that joins 38 scientific societies of the health sector, and of course all the health professional associations. And we had a role in the 2010, very important when I was the president, because in those days was being passed the law, in the last law, tobacco law in the Spanish Parliament, and we were representing the voice of the health professionals. And to the side was the tobacco industry with his front group that in that time, in those times where it was the hospitality sector. But the fact was that I was a dentist, and I was proud. It was the first time that a dentist was the president of the National Committee of Tobacco Prevention, and I was talking on behalf of all the health professionals of my country. After I was elected president of ENSP, and again, it was the first time that a dentist was the president of ENSP. And when I was the president in these years, I have to travel many occasions to Brussels, and I visited several times the European Commission, and I have some meetings with people working there, especially in DG Santé, and they were surprised when they knew that I was a dentist and I was advocating for tobacco control. And that's something that I never could understand. So I asked my board to try to create a working group on oral health and tobacco, and dental profession and tobacco, dental profession, dental team, all the members of the dental team and the tobacco, the approach to tobacco. That was accepted by the board, and we create this working group that started with a first meeting in Bucharest in March 2019. We were not too much there. We were a few dentists, but in fact we started working, and we agreed to have 3 main lines of work. First of all, to monitor publications and scientific evidence about tobacco and new nicotine-containing products and oral pathology. And I say new nicotine-containing products because sometimes dentists can add some interest things. For instance, I can tell you that we have seen that compared to smokers of conventional tobacco, conventional cigarettes, smokers of electronic cigarettes present a higher rate of nicotine stomatitis, hyperplastic candidiasis, and black hairy tongue. That's very, very specific for vapors. So it's important to monitor all these type of publications. The second line of work was to improve the training in effective tobacco counseling and treatment skills, and in tobacco control in the curricula of dental faculties in Europe, and also to increase this knowledge in the dental teams through continuous training programs organized by their professional associations. That was the second line where we wanted to work. And the third one, for me, very, very important, it was to promote the participation of dental professionals in the design and implementation of tobacco control policies at local, national, and European level. Well, we took 2 decisions in this meeting, in this first meeting of Bucharest. The first one, it was very simple. It was to participate as a group in the next ENSP conferences. We used to have one or 2 conferences every year, in order to make available a forum to discuss for the oral health community and all of the people interested in oral health and tobacco. And the second one, it was to produce a statement reflecting the importance of the topic and our commitment as dental professionals to contribute to its solution. We started to work on this online in the group, and we had a meeting in person. It was possible in those days in Madrid. Thank you, Carmen, for your help organizing this meeting in Madrid. And we meet there. There was some of us attended via online. I think here is Dr. Resende. Dr. Resende was the representative of the Council of European Dentists. She attended from Portugal. And also it was the representative of the Spanish Society of Oral Surgery, that, by the way, they wanted to be here today, but they have asked me to apologize because for a last-minute problem, they will not be present with us. But I want to also thank you for their participation. We met there and we agreed the final text for this statement. And then we were very, very excited because we arranged a very, very nice event in the European Parliament where we were going to present this statement. And here I have a copy of an email that I sent to all of you saying on the 20th of February of last year, that the 18th of March of 2020, we will celebrate the World Oral Health Day in the European Parliament, presenting our statement on tobacco and oral health. But unfortunately, you know what happened. Everyone knows what happened. And only the 2nd of March, that means 16 days in advance to the meeting, we received an email from our General Secretary Cornell saying that the President of the Parliament had cancelled every event in the European Parliament building. Well, as many of the members of the group and even participants have booked their flights and they had also registered the hotels, we tried to keep the meeting in a way of a partial meeting of the working group in our offices in Brussels, and that was the 10th of March. But unfortunately, the 15th of March, some countries like Belgium and Spain banned travel, and then we had to cancel and postpone, unfortunately, this meeting. Well, I suppose that most of you have read the document, so I don't want to read the document, but I want just to make some or highlight some points of the document. And I would like to say what you see in the bottom of the screen, that as health professionals, we want to assume our responsibilities in the implementation of public health policy regarding tobacco control at European level. I want to say very clear that dentists want to participate when the health advocates, the politicians discuss on tobacco control, because we are health professionals and we want to participate. The structure of the document is, we have two main points. One is an introduction that we have named as an awkward, inconvenient truth, after we talk about why it does concern us, After we talk about what should be done, and we add at the end some conclusion and annexes. And well, going very fast and giving time to the other speakers, but in the first part, this an hour inconvenient truth. Well, we make a general explanation of the situation in Europe regarding tobacco, and we use the situation in Europe. We use the FDI. We use the FDI Declaration on Oral Health for this point, because it's very clear and very useful for us. So here we reflect what the FDI is telling about what happens with the tobacco consumption in the mouth. That's FDI. The second point, we try to say what does concern to us. And here we are using mainly what the WHO is saying about this, because the WHO has an excellent explanation about the why dentists are concerned, how this affects to our practice and to our daily work. After this is more production of the group, we try to explain or to say what can or what should be done, and then we again present 4 main points. One is education, because we, in practice, we are seeing a lack of training in effective tobacco counseling and treatment in our colleagues sometimes. And we think that all health professionals should show some competence in these skills, some minimum competence. After we talk about the role model that dentists and health professionals must have in front of the society, and also we talk a little bit about the dissemination. We must disseminate these ideas. We must explain to the population what's producing, what's happening with the tobacco in the mouth, what's the problem with tobacco, and I think that's our responsibility to do this and to say this. After, we have a third aspect that is, I think, very interesting, that is what should be done. And then here there's a phrase of a dentist from the United States, Robert Mecklenburg, that I admire very much, that he says that helping patients to stop smoking may be the single most important service dentists can provide for their patients' oral and general health. And that's true. That's true. So we start speaking a little bit about this, about the importance of this point, and we finish also with a phrase of Jesper Reiby, again the WHO, that say that given the evidence, tobacco cessation activities should be as natural as oral hygiene measures in our offices. The next point, we try to explain that we should promote the normalization. This is very important because tobacco industry always tries to renormalize the conduct of smoking, and they want to explain to the citizens, to the population, that smoking is the norm, is the normal. And in some countries like mine, where the percentage, the prevalence of tobacco consumption is high because we have 25% of the population is smoking, we must realize that the normal is not smoke, because 75% of our citizens are not smokers. So it's something that we must try to transmit to the population. I think it's very important. And we finish with two small annexes. One is a very short annex where we explain all the effects of the tobacco consumption in the mouth. And the second annex is the main tobacco control policies that, for those familiarized with tobacco control, is the Empower strategy of the WHO. It's very clear. It's the points that are effective and that we consider that must be reflected here. So this is more or less the statement that we want to present today, that will be official and will be officially presented today. And in summary, I would like to read these conclusions because I think it's important to say it. The ENSP Working Group on Tobacco and Oral Health supports training and education for dental professionals to ensure that all of them have the knowledge, skills, and support systems necessary to inform the public about the health hazards of nicotine and tobacco products and to provide effective tobacco cessation strategies. Recommends to the different European dental associations to educate and inform its membership and the public about the many health hazards attributed to the use of traditional and non-traditional nicotine-containing products. Encourages the European health authorities to promote independent, basic, transnational, clinical, and population-based research on the new tobacco and nicotine-containing products to create the evidence base necessary for regulators and policymakers to protect the public's health. And asks the European Commission, the European Parliament, and the different national parliaments to count on oral health professionals when legislating on tobacco control measures. And that's all from my side. Thank you very much.
Thank you, Francisco. Just my colleague Paulina put the link to the statement on the chat box. So for our dear participants, you can access the statement and take a look on it. Again, thank you, Francisco, for this introduction, for the statement. And now Dr. Marco Landi will talk about what can be done, the role of oral health professionals on tobacco and oral health. Dr. Marco is the president of Council of European Dentists, and before that he was the board director and vice president of the Council of European Dentists. Dr. Marco, the floor is yours.
Thank you, Hani. I try to share my screen to see. Yes, can you see my presentation? I try to be very short because the most important thing has been said by Paco, and I know that other distinguished lecturers that will follow me will say the most important things on clinical aspects also of involvement of dentists. My role as president of the Council of European Dentists is mainly a political role. And this is what I would like to stress today. What is CD? CD is the voice of dentists in Europe for many, many decades. We are representing 33 national dental associations and over 340,000 practicing dentists. That's very important. We have a large number of practicing dentists, those who are really hands-on on a daily basis on patients in all these countries. So we are the main representative of the dental profession with European institutions. So our role, as I told you before, is mainly political. So our mission is to promote high standards of oral health, dentistry, and effective patient safety center and evidence-based professional practice across Europe, to promote the interest of the dental profession and to ensure protection of public health. So as you can see, our role is overlapping those of associations and the role of chambers. We pursue public interest. So we are not only defending the dental profession, but public interest and public health. And I'm happy for this reason to be invited today here, because this role is of high importance, and being recognized as a leading part of our profession is paramount for us. Having this in mind, this mission in mind, so the CED has been active on the topic of tobacco for many years through the work of our permanent working group Oral Health. Also, the resolution that we adopted in 2013 on the Tobacco Products Directive and the representation, obviously, current representation in the Nsp working group on tobacco of oral health. We were very happy when Paco invited us to participate, and so I hope that our participation gave some support to the activity of Nsp. In 2013, the CD welcomed the Commission's initiative to review EU legislation on tobacco and the opportunity to comment from the perspective of the European dentists. In its resolution, CD published the same year, expressed the voice of European dentists as health professionals, strongly supporting any initiative that has as its aim improving general and oral health of Europeans. The CD was successful in flagging the need for a high level of health protection and the decision to focus on provisions that would reduce the prevalence and uptake of smoking, especially among young people. So the Tobacco Products Directive, as you know, entered into force in May 2014 and became applicable in EU countries in 2016. and you know exactly what the directive lays down, governing manufacture, presentation, sale of tobacco, and this includes also cigarettes, rolled tobacco, pipe tobacco, cigars, cigarillos, and so everything is used and creates addiction to our citizens. So as health professionals directly and most immediately concerned with the diseases and conditions of the mouth, we continue to particularly support initiatives related to tobacco use and call for, as Paco mentioned, their normalization of tobacco products, especially of their availability and presence in non-specialized retail outlets where new smokers might be recruited. Moreover, we support the EU intention to encourage full implementation of the WHO Framework Convention on Tobacco Control, to which the EU and all the member states have signed up. Through its resolution and work, the CED aims at supporting the EU institutions in their fight in diminishing tobacco consumption, but also raise awareness regarding the importance of oral health to be included in the public health programs dealing with tobacco, as well as the paramount role that oral health professionals play. Recently, in November 2019, CED General Meeting approved a white paper on oral health prevention. Prevention is better than cure is the title of this resolution. It is very important because it embraces all the aspects of general health and oral health, and tobacco is mentioned several times in this white paper because we want to be strongly committed to this fight even in the following year. So what is the oral health professional's role? I don't want to give you too many details because many of you knows better than me. Even if I was, I can mention the fact that probably Italy was one of the first country to translate the FDI advocacy guide on tobacco quitting, and I was the one that with the Foundation of Italian Dentists promoted this Italian translation. So I was highly committed to this fight against tobacco from the years before my presidency in the CED. So in order to contribute to the fight against tobacco use, oral health professionals can also be engaged individually in their practice by educating patients regarding the risk of tobacco consumption, the diseases caused by tobacco use, such as respiratory diseases, heart conditions, multiple types of cancers, including obviously oral cancer. We are promoting oral cancer campaign. Paco is well aware of what CD did also in the European Parliament about that. And so this is always one of the main topic in the activity of working group oral health. So again, the oral health professionals can be engaged also in motivating and disseminating best practices on tobacco cessation, but also leading by example. That's the main problem. Unfortunately, many colleagues are smokers, and we have also an internal fight to be fought against those colleagues that are not well understanding the importance of being the first example for tobacco quitting. And moreover, I should say dentists are highly motivated in their advocacy role also by the increased rate of clinical failure in treatments which play a key role in oral rehabilitation, like dental implants and periodontal surgery. So this is obviously an internal motivation, but also leads to being more and more active in this campaign. Also, in our daily practice, we raise awareness on oral health consequences of smoking. We emphasize, obviously, the impact on oral health, from discoloration and bad breath to high risk for developing periodontal disease, caries, and even cancer. So I firmly believe that we have a powerful weapon to convince patients to quit smoking because cosmetic is a daily request from our patients, and we should rely on this request to convince, to give more power to patients to quit smoking in the name of cosmetics restoration of their mouth also, because not always they understand immediately the consequences on general health and oral health, especially when we try to motivate young patients that are really far from being aware of the risk of losing their life. This is something that we know. Finally, we promote adequate oral hygiene habits, and we combat unhealthy habits, also sugar consumption mainly, but also tobacco, supporting the implementation of tobacco control public health policies. And finally, we get involved in national public health campaigns aimed at reducing the prevalence and uptake of smoking. So we are trying to collect experience from our members about what they are doing on this issue at a national level, and I hope to come back to you with some national information on what has been done by dentists at the national level. So finally, we welcome the Nsp Position Statement on Oral Health and Tobacco, as well as these events where important actors in the oral health arena are gathered to discuss ways in which we can tackle one of the most pressing pandemics, that is tobacco consumption. So the CD will continue working on the topic, and we look forward to new initiatives in the future. Let me say one last thing about what Paco mentioned on the need of reviewing dental curricula. Paco knows very well that we are struggling reviewing Annex 5 of Professional Qualification Directive since many years. And I can say that it's very difficult to find a way to motivate European legislators to make dramatic changes in dental curricula that are really, really needed to have our future dentists in line with the needs of oral health and global health of European citizens. So thank you very much for the invitation.
Thank you, Dr. Marco. It was really very interesting, and of course the role of oral health professionals is very essential for tobacco cessation and for raising awareness amongst among their patients. Next speaker, Dr. Benoit Vernier. Dr. Benoit is dental officer in the Prevention of Non-Communicable Diseases Department in World Health Organization, HQ Geneva. Dr. Benoit, the floor is yours.
Thank you very much, and thank you, of course, for inviting me. It's a real great pleasure, and I, of course, read carefully the position statement from UNSP, and I can tell you that WHO view is really aligned with what UNSP is proposing and developing. So thank you so much for this initiative, and so I will try through my presentation to give you an overview, quick overview about burden and challenges, related to oral disease, and after that I will enter in more details about the evidence, about the association between tobacco and oral disease, and try after that to see, the WHO position, and also, of course, what kind of activities we are implementing in support to countries. So first thing, of course, it's even I think all the attendees knows we are facing a very, very important challenges, and more or less half of the world population is affected by some form of oral disease. So which makes them the most frequent of all health conditions in humans. This is the figures coming from IHME, the global burden of disease. And also this slide show that at global level, we can see that there are no important improvement of the situation in terms of burden of our disease between 1990 and 2070. So this is definitely the situation today. Of course, when we are referring to oral disease, as you know, there is a long list of disease, but I think it's important to focus on the main, of course, dental caries, periodontal or gum disease, cancer, and this is definitely important when we are talking about tobacco use, oral dental trauma, cleft lip and palate, and also some more neglected disease like NOMA with a severe gangrenous disease. Another aspect also when we are talking about oral disease, they are life-cause disease. So it means that it's not only like some communicable disease or even some specific disease, you know, there are some age group who we could focus our attention because we know that it's between childhood, for example, or later aging time that some disease could appear. But for oral disease, it's really over the lifetime that people could be affected. And this also it's important in terms of strategy to ensure that we can, of course, talk and improve the situation. We also know, of course, that oral disease are affected vulnerable and marginalized population and those of lower economic status. Another important fact, I think it's just to be clear, and this also it's really a window of opportunity for oral health community and more policymakers also to be aware that there is 4 common risk factors, you know, that are modifiable risk factors that are common to the 4 leading non-communicable disease. Cardiovascular disease, cancer, diabetes, and respiratory disease that are sharing the same risk factors with the main oral disease. And of course, part of these common risk factors, we have, of course, tobacco, we have also alcohol consumption, and of course, a poor diet or unhealthy diet. So now when we enter into, of course, the relationship between tobacco use and oral disease, I think we have a quite strong evidence that show, you know, that tobacco use means all forms of tobacco use is responsible for a significant burden of oral disease. Major risk factors for oral cancer, of course, is tobacco use, both smoking and the use of smokeless, chewing tobacco. These are really strong evidence that have been proven to cause mouth and pharyngeal or throat cancer. And we know also that in most countries, 50% of patients affected by oral cancer die of the disease within 5 years. So for those surviving, there is considerable facial disfigurement and loss of function. So it's also something that, of course, we have to consider when you are, of course, working on this area. So in 2017, 2018, WHO Health Program, with, of course, the colleagues of the tobacco program, developed a monograph that provide updated evidence. And definitely one of the conclusions, of course, and that oral disease and tobacco use a deadly combination. I can just mention this the fact that tobacco use causes over 90% of cancers in oral cavity, and then more than half of the periodontitis among adults may be attributed to tobacco use. I think it's important also to mention this work that have been developed in 2014 by IARC, International Agency on Research on Cancer. And so they established a list of carcinogenic agents by target seeds. And it's of course based on the critical reviews and evaluation of the weight of the evidence that an agent can increase the risk of cancer in human. And you can see, even it's maybe a bit small, that tobacco use, again, all forms, including chewing and betel quid, are widely practiced, of course, in many parts of Asia, as we know, but are definitely linked, strongly linked with oral cancer. And this slide, so it's a good opportunity to announce to you that WHO and IARC in collaboration started recently, means 2 weeks ago, the development of a new handbook on the prevention of oral cancer. So I think it's a great initiative, and this handbook that will contain also, of course, a review of the best evidence, but also a number of recommendations toward policymakers will be available next year, end of next year. Of course, even regarding electronic nicotine delivery systems, there are more questions than answers at this time. The evidence are quite thin, and the research should really targeting this new way, new or not new, but definitely with increasing, and particularly among young people. We know that this electronic nicotine delivery system are likely to be less toxic than cigarettes, but there is insufficient really evidence to quantify the precise level of risk associated with them. So many factors will impact on the relative risk associated with the use. I can just give an example: the amount of nicotine, and other toxicants in the heated liquid are usually unknown. Of course, the big tool and the big initiative, as it was already mentioned by some speakers before me, is the WHO Framework Convention on Tobacco Control. It's definitely a powerful tool to reverse tobacco epidemic. So, of course, there is a growing success of the WHO FCTC tool, and with more than 180 parties that demonstrate the global political will to strengthen tobacco control and save lives. Just a reminder, this FCTC has two main objectives. The first is establishing tobacco control as a priority on the public health agenda, and also to introduce a mechanism for firm country commitment and accountability. Now, in terms of the role of oral health professionals, so this is according some results, some figures according to a global progress report, on the implementation of the WHO FCTC, shows that around 50% of parties reported that dentists offered counseling services, and this it was in 2016. But we also know that despite the increased involvement of dental professionals in the provision of smoking cessation, only less than 30% of members, parties, or countries who have ratified the FCTC reported that tobacco dependence treatment incorporated into the curricula of dental schools. And this is definitely a subject that should be highlighted and to really improve the situation, as the president already mentioned in the statement. So based on this situation, on this progress report, again, WHO oral health program, in association with, of course, colleagues working on tobacco, develop a set of tools, to try to increase the involvement and the integration of oral services, more broadly speaking, into other services. So we have a WHO monograph on tobacco cessation and oral health integration. We have a training package, strengthening health system for treating tobacco dependence in primary care, and a guide and a toolkit, directly for oral health professionals to deliver brief tobacco intervention. And all these documents, of course, are available in the web site in WHO. For all. And of course, one of the recommendation of these tools and document is definitely to mark the fact that oral healthcare providers have a really unique role, in tobacco control. First, of course, they can serve as tobacco-free role models for the dental patients. And this is, I think, very important. They can address tobacco dependence as part of your standard or dental care practice, and of course access exposure to second-hand smoke and provide information about avoiding all exposure. And this should, of course, be implementing, in the context of the integration, of this tobacco intervention into oral health program in primary care, particularly. So as part of this tool, there are what we call the 5 A's model. First, to help patients ready to quit. So there is, I do not want to enter into the details, but it's quite well-known, approach to help, following a logical question and answer with the patient to, again, help them, in this case, when they are ready to quit. There is another model called the 5 R's models. This one is, the objective is to increase motivation to quit, because we know that it's not all patients who are ready to quit. So again, it's a logical set of question and discussion that should be established during a dental consultation. And the last one, it's the objective of to avoid exposure to second-hand smoke. Again, so these 5 A's models have been applied, and we started 3 years ago, to pilot in Japan and in Thailand this methodology. So now I just want to open a bit the windows in terms of opportunity, within WHO and within the governing bodies of WHO, just to mention that on the past, oral health has been, integrated in a number of political declarations. For example, on NCD in 2011, it was the second time, in New York that all the member states, discussed about health issue. And after that, so we had a number of regional initiatives, to try to push the global health agenda in the UN and WHO system. More recently also, as you know, UHC, universal health coverage, is definitely a strong opportunity to try to push so better accessibility and affordability of oral health care. So all these journey regarding oral health has been fragmented. But the very good news is, and it's the reason that I want, of course, to inform you or just to remind you. So we had in January this year, 2021, a landmark resolution on oral health that has been adopted by the executive board of WHO, and that will be discussed in May this year during the World Health Assembly. And it was, I don't know if you have, of course, the chance to follow the discussion in January, but it was quite impressive, you know, to see the commitment, you know, and the interest of member states about oral health. And I think we really reach out a consensus, you know, to of course, to say that oral health has been neglected for a long time now in the global health agenda, and it's really time to act, to move. And the very good news is now we have a resolution on oral health, and it gives, of course, a strong mandate to WHO, but also it's a huge responsibility for all member states, but also partners, non-state actors, and other NGOs that are, of course, working and promoting health in the population. So this resolution, you know, requests WHO Director General to develop a global oral health strategy by the end of this year, and a number of other key policy documents, you know, to ensure that by 2030, the situation, of course, will be improved regarding oral health status of population. So all these steps and again, strong mandate will be a fantastic opportunity, you know, for WHO, but also for member states and partners, you know, to push the tobacco, of course, into oral health agenda, and to really improve intervention and activity to improve the situation, and of course reduce the use of tobacco in this respect. Just to show you exactly our main activities at WHO Oral Health Program. So of course, first priorities, we are now finalizing WHO Global Oral Health Report that will be available soon, of June or July this year. And of course, it would be the starting point for the development of the Global Oral Health Strategy. My last slide is just a short set of key message, you know, for the oral health community, because as mentioned, of course, dental professional is clinician and oral health providers, but also a number of additional practitioners. It could be also some technician or dental nurses or oral hygienists. I think we have to work together on this, but it also some academic and people in charge of research. So we definitely need to work again together in collaboration to improve the situation. So of course, support WHO strategy and recommendations, such as what I mentioned to you, this set of tools. I think that would be really important. Of course, promote healthy living and working environment, also conducive to healthy lifestyle, like smoke-free environment spaces. It's something that we have also to improve. Raise awareness about the NCD epidemic and advocate for reduction of the NCD common risk factors, including, of course, tobacco use in your community, in the oral health community. I think also there is a very important role as advocate, you know, in this sense. After that, of course, UHE agenda to try to ensure that all the intervention proposed, would be really integrated into NCD agenda, but also universal health coverage is something that could make the intervention more effective. I will stop there. Thank you for your attention, and again, happy World Oral Health Day. Thank you.
Thank you, Benoit. As Dr. Benoit mentioned, the ways or some methods of treatment or intervention, I want to use this occasion and mention that ENSP has published tobacco cessation guidelines. We have it on Nsp website in 18 languages, including Arabic language, Spanish will come soon, and Chinese, we hope that also will come. So we cover all official languages. You can access it on Nsp website, and it is very helpful. There is many types of intervention, including pharmaceutical intervention also. Also, as Professor Ihsani Ben Yahya will be our next speakers, I want also to mention here and remind, maybe some of you already know that many years ago, the FDI and WHO published a good guide for oral health professionals called, I think, Tobacco or Oral Health. Actually, it's very interesting, and you can access it on FDI website. So Dr. Ihsani will talk about the position of FDI, and Professor Ihsani Ben Yahya is PhD in dental medicine, Professor of Higher Education in Oral Medicine and Oral Surgery, and FDA President elected. Dr. Ihsani, you are welcome. The floor is yours.
Thank you, Dr. Hani. Greeting everyone. Thank you so much for your kind invitation to speak today about the FDI position on tobacco and oral health. I will share my screen. Excuse me. Okay. So, just a few words about the FDI. FDI World Dental Federation serves as the principal representative body for more than 1 million dentists worldwide. It is the global voice of the dental profession and works with its member organizations to improve the oral health of people worldwide. FDI is one of the oldest organizations in the field.
We're not seeing, you are not seeing, watching your screen.
You can.
Yes, please.
Excuse me. You can.
You cannot see it.
Oh, excuse me. Okay, so I will repeat. So.
Yes, please.
Arrêter vidéo, écran. Excuse me. Okay.
You must find share screen there.
Is it okay now?
No, still not. Still not.
No? Pardon.
On the bottom of the monitor, maybe you can find share screen.
Now?
No, it's okay.
Yes.
Perfect. Thank you.
Okay. Thank you.
Perfect.
Excuse me. So sorry. Just a few words about the FDI. Donc, FDI World Dental Federation serves as the principal representative body for more than 1 million dentists worldwide. It is the global voice of the dental profession and works with its member organizations to improve the oral health of people worldwide. FDI is one of the oldest organizations in the field of Dentistry, and its membership comprises some 200 national dental associations and specialist groups in over 130 countries. In 1996 and in 2004, FDI developed two policy statements in which it strongly supports and encourages all activities aimed at preventing initiation, reducing consumption, and controlling second-hand smoke caused by tobacco products. In 2005, we also developed a first tobacco or oral health, an advocacy guide for oral health professionals. So, Dr. Hani, you said about that in your introduction. Thank you. It is now accepted that helping tobacco users to fight is part of the role of health professionals, including dentists and other oral health professionals. It is also formally recognized that tobacco cessation is part of the practice of dentistry. The most significant effects of smoking on the oral cavity are oral cancers and precancers, the increased severity and extent of periodontal diseases, poor wound healing, and reduced initial long-term success of dental implant. Smoking has been shown to affect both taste and smell. Halitosis and tooth staining, which are both visible and reversible, have been shown to be common concerns of smokers and can be used as motivations for quitting. The clear link between all diseases and tobacco use provides an ideal opportunity for all health professionals to take part in tobacco control and cessation programs. All health professionals, individually and through their professional associations, have a prominent role to play in tobacco control. Health professionals have the trust of the population, the media, and opinion leaders, and their voices are heard across a vast range of social, economic, and political arena. Through their practice, all health professionals are particularly concerned about the adverse effect caused by tobacco use in the oropharyngeal area of the body. They typically have access to children, young people, and their caregivers, thus providing opportunities to influence individuals to quit or never been using tobacco. All health professionals often have more time with patients than many other health professionals, providing opportunity to integrate tobacco cessation intervention into daily practice. And they often treat women of childbearing age and are thus able to explain the potential harm to babies from tobacco use. And they see patients quite regularly, so can build the patient's interest in discontinuing tobacco use by showing the actual effects of tobacco in the mouth. All health professionals are therefore in a unique position to contribute to tobacco control in a number of complementary ways, as role models by not smoking, in counseling patients not to smoke, in referring patients to smoking cessation services, in speaking out publicly and advocating comprehensive public policies to control tobacco use. National dental associations and all health organizations are also ideally placed to mobilize other healthcare professionals, such as doctors, nurses, and pharmacists to become involved in tobacco control initiatives. It is imperative that all health professionals recognize that their professional duty extends beyond the treatment and cure of tobacco-caused disease to include prevention and cessation. To support all health professionals, the FDI developed a tobacco cessation guidance for all health professionals, introducing the widely recognized 5 A's and 5 R's models, and is developing short video animations to illustrate interactions with patients. I would like as well say that FDI has in 2018 developed a toolkit as well as a leaflet about oral cancer and its relationship with the main etiologic factor, which is tobacco. You can check in our website for more information. So wish you all an excellent webinar and daily, and thank you so much for your kind invitation. Thank you.
Thank you, Professor Hassan. Our next speaker will be Dr. Eliana Stofi. Dr. Eliana will talk about oral cancer. Eliana has been in the field of oral medicine for over than 35 years. Has many activities through these years, from teaching, graduate and postgraduate students, also in clinical practice. Dr. Eliana, of course, thank you very much for preparing the video. She is with us online, but for some reasons she cannot present, but we have recorded video for her, and we would like to thank her very much for her kindness to send the video and make the presentation within even her with these conditions. So we'll start the video right now. Hope it will work well. Do you see it? It's okay? The sound?
No, honey, there is no sound.
Okay, just 1 second.
Maybe you start the video, maybe we can hear it.
Okay.
No.
No, still not.
We can't hear.
You cannot hear, okay. Paulina, can you try from your side, please? Still the same.
Doesn't work, honey?
No, we cannot hear it. It's the same. It's the same.
Okay, let me try like this. And now?
Greetings from Athens, Greece.
Okay.
To start with, I would like to thank the president of ENSP, Mr. Lozano, and Dr. Goumani for the invitation to this webinar. My today's presentation is oral cancer and smoking. What do we know, what has been done, and what needs to be done? Let me introduce you to oral cancer. It's a multifactorial disease. The cancer of the oral cavity represents the 5% of oral cancers. Men are affected twice as women, 2-to-1 ratio, and the mean age is 40 to 50 years of age. It is the 6th more common malignancy at a global level, not that rare. Most common oral cancer malignancy is squamous cell carcinoma, which represents 90 to 95% of all cases and is closely related to smoking. 650,000 new cases of oral cancer worldwide every day, and 300,000 deaths are reported every year, killing roughly 1 person per hour, 24 hours per day. Oral squamous cell carcinoma's diagnosis is usually late. Of those newly diagnosed individuals, about 50% of them will be alive after 5 years. Therefore, early diagnosis is very important. Early diagnosis has a 5-year survival rate over 90%, while, as we said, late diagnosis only 50%. It is estimated that at the time of diagnosis, there are metastases in over 50 to 60% of the patients, which are diagnosed at stage 3 and 4. It's understood then that action has to be taken to have an early diagnosis. Oral cancer kills as many people as melanoma and is now more common than leukemia. Which are the predisposing factors for oral cancer? Smoking, smoking, smoking. 70 to 90% of smokers are the ones who present with oral cancer. Alcohol consumption and HPV viruses are implicated with the disease. And other factors are chronic mechanical irritation, chemical burn, diet, gene transformation, and systemic diseases. Smoking and oral cancer are almost like a person and its shadow, inseparable. The pooled risk estimate of oral cancer is 3.43 times higher in smokers than in non-smokers, while for lung cancer is only 2.67% when they smoke 20 cigarettes per day. Oral cancers arise as a result of mutagenic events from the carcinogens that are included in tobacco, and they cause multiple molecular genetic events. One cigarette, we have to remember, contains over 7,000 harmful chemicals, from which 70 are known to be carcinogens. Smoking cessation now is associated with reduced risks for oral cancers. The risk for oral cancer of former smokers approximates that of never smokers after some 10 years of quitting smoking. Furthermore, stopping smoking before middle age has been shown to reduce the lifetime risk of developing oral cancer from 1.4% to 0.5%. Let me show you some pictures, not very pleasant ones, of early stages of oral cancer. You see, they can present like little ulcers anywhere in the oral cavity, in the mouth, even on the lips. This is where we want to detect it, because maybe the patient is patient, but cancer is not. And if we don't diagnose early, this is what we will have to confront later, the advanced stage with huge lesions which have metastasized, as you see in the last picture to the right, to the lymph nodes or other organs. Which are then the fundamental parameters for early diagnosis? First, public awareness. Best treatment of oral cancer is prevention. There are studies that they report an alarming lack of awareness about oral cancer, its symptoms, and predisposing factors. Education of the public on elimination of tobacco consumption and moderation of alcohol intake is urgently needed. Also, the role of oral physician is very important, since we, the oral physicians, are the first who will encounter a precancerous or cancerous lesion. Therefore, they must have a high index of suspicion and knowledge of the early clinical characteristics of the disease. And last but not least, early referral to the oral medicine specialist, because The earlier the diagnosis, the better the prognosis. And again, early diagnosis saves lives, while late diagnosis leads to death. Therefore, our target is dual for the oral cancer prevention. First, to fight for smoking cessation, and second, to have early diagnosis if it is happening. What do we know? What facts do we have in Greece? In Greece, of almost 10 million population, or a little bit above, it is estimated that we have approximately 600 to 700 new cases of oral cancer per year and about 200 deaths. These numbers are not accurate, unfortunately, because Greece has not yet a reference center to record the cases diagnosed. 27% of the population is smoking. These numbers have been improved a little bit as we see later on. Only though 14% of the public is aware of oral cancer and its close relation to smoking. We have done smoking cessation campaigns in Greece, which so far were not effective because the existing law was not applied. There was not a sustainable and well-organized campaign against smoking, and there were no awareness programs, especially for the youngsters, our teenagers. Since the new government, as of November 2019, serious action has been taken with immediate enforcement of the new ban law, which allows no exception, and the results are encouraging. The last information we have from the Greek Statistical Services as of December 20, the numbers of smoking prevalence in Greece have greatly improved, and we see, which is very interesting, that we have in the adult population only 24.5% of people who smoke. And what is even more interesting is that we have a decrease of everyday smokers and occasional smokers to young people, 16 to 24 years of old, to 52.4%, very encouraging. How did we plan our prevention and early diagnosis campaign of oral cancer? In 2014, the Greek Ministry of Health, the European Association, and the Greek Dental Association sponsored a nationwide 2-year campaign for all 13 municipalities of Greece in collaboration with the mayor of each city and the local dental association. The campaign was designed to address both the oral physicians and the public, aiming to raise awareness regarding oral cancer. How did we design this campaign? First, it was addressing to the public by producing pamphlets, giving the information we wanted to, with presentations to inform people about oral cancer and risk factors, especially smoking, video with instructions of self-examination for early detection, TV and radio interviews on a local and international media, and also a site was created for those who wanted to get further information. On the other hand, we addressed to the oral physician by making a handbook with scientific presentations and evaluation forms to see how effective this program was. This is how we presented to the public our campaign. As you see, we had pictures, a pamphlet for the public and a handbook for the dentists. And this was the title of our campaign, Stick Your Tongue Out to Oral Cancer. And we focused on informing people, public, with some statistics and focusing on who is in danger, aiming first to the smokers that we say that they are in danger 4 times more than those who do not smoke. Those who consume alcohol and they stop and they smoke, they also have greater danger. And what precautions could they take? Stop smoking and stop alcohol consumption. The outcome of the campaign was encouraging, but there was no follow-up at the end of the projects since there was no funding available. This type of campaign needs to be repeated on a constant basis until people are educated about oral cancer and they acquire a non-smoking lifestyle. Furthermore, campaigns should be kept current to include new forms of smoking habits like e-cigarette or vaping, which are as hazardous as conventional smoking. And of course, funding is needed. But what's missing? Primary prevention counseling about risk factors such as smoking, alcohol consumption, and HPV virus should be stressed more. Confront new lifestyle trends in smoking habits, as I said, vaping and e-smoking. Secondary prevention by having early diagnosis and treatment to reduce complications to the patients and costs for the governments. And of course, we should focus on our teenagers, because that's where the smoking factory aims, the young population. And regarding youth, our long-term goal should be prevention of all forms of tobacco products, to reduce the young population health harms of tobacco use, and achieve the goal of total prevalence of smoking below 5% by 2040. This can be achieved by providing tobacco education in school health services and students, including education on health risks associated with vaping nicotine products. And of course, there has to be an interprofessional training, mainly between oral physicians, in association with cross-training of nurses, medical doctors, and pharmacists. Also to have a core curriculum training at the medical and dental schools, and provide continuing education course training. You will allow me to say a few words about the role of dental healthcare professionals. Smoking cessation counseling by dental healthcare professionals is effective, cost-efficient, and provides benefits to patients. Prevention of oral cancer by provision of tobacco cessation activities and screening by oral health professionals in primary care should be embedded in policies strengthening oral health services. Therefore, dental health practitioners should be trained to educate, counsel, and treat or refer their patients regarding smoking cessation. And what are the goals for EU? To design a common strategic plan to be applied to all European countries, aiming to the prevention and early detection of oral cancer, and to emphasize to the relation of smoking to oral cancer, and two, to the cooperation with the dental associations of each country. For Greece in particular, we have to perform screening of the dental population for the oral malignancies, create a national network of reference for malignancies, including head and neck, and address the public to aware them on both oral cancer and smoking cessation. For all of that, funding is fundamental. But the above actions will save lives and limit government costs in the future. Again, I have to stress the point that all this effort is a teamwork that includes all the medical profession specialists in order to achieve better health and to benefit and not harm the people, as Hippocrates said centuries ago. Thank you very much once more. Greetings from Athens. Thank you for the attendance.
Thank you very much, Dr. Eliana. Very interesting. Actually, the campaigns must be repeated all the time, because all the time we have new products, and all the time we have new smokers, all the time we have new oral health professionals. Even if the tobacco control materials or literature will be added to the curricula of medical schools or oral health school in general. Our next session will be moderated by Dr. Francisco with some of the members of the working group on the statement. Francisco, please, the floor is yours. You can start.
Thank you very much, Hani. Well, I think it's very important now to have the opportunity of watch and hear some of the members of the group who are behind all this statement. Of course, we have elected some different members because they represent different positions. We have, I will introduce to all of them. So what I want to translate here is that from different positions, from dentists working in different places and in different positions, they can do very much. And so we want to hear the opinion of each of them. So we will start following the program with Francisco Cabrera. Francisco Cabrera is the president of the Canarian Dental Foundation. This is not only association, he also is the president of a dental association, but he is the president of a dental foundation. That is an institution that, well, he will tell it better than me, but they try to transmit to the society the values and the ideas of the dental profession. It's a link, a foundation that tries to establish a link between the society and the dental profession. Please, yours the floor, Francisco. Sorry, Francisco, we can't hear you. You must activate your...
I'm sorry. It's okay now. Thank you, Paco. Dear colleagues, good afternoon from the island of Lanzarote, south of Spain, and very sunny, near Africa. No, so. As president of the Canary Trust and the official College of Dentists in Las Palmas, I want to thank to ENSP and to his president, Dr. Lozano, for the invitation. The World Oral Health Day is devoted especially to rolling out awareness campaigns and activities designed to alert people, adults and children alike, of the important benefits to be derived from oral hygiene, together with healthy eating habits and a better overall lifestyle. One of our main messages then is based on the close links between oral health and smoking. We consider that we must underline the harmful effects of tobacco addiction and health, above all the young, who we attempt to alert with respect to the harm that tobacco in all of its shapes and sizes can have on oral health and health in general. In Spain, there are 7,000 new oral cancer diagnoses each year, and over 70% of the oral cancer are preceded by precancerous oral damage. The main danger of oral cancer lies in its late detection, accounting for death in 25% of all patients. The oral biopsy, as carried out by a dentist, probably is the best way of ascertaining whether oral damage is cancerous or precancerous, and getting in with an early diagnosis that may improve the possibility of survival of the patient. That is why our training and educational campaigns on the subject are also directed to dentists. So our work is not only to underline the importance of the dentist in detecting, preventing, and combating the serious consequence of tobacco consumption, but also as health professionals who should advise to our patients to give up smoking in pro of the overall health. All which goes to show that we dentists, the health professional who look after the oral health of our patients, should be actively involved in defining the policies of control on smoking and use of tobacco in Europe. Thank you very much.
Thank you very much, Paco. Thank you very much. Thank you for your kind words. I forgot to mention that between the members of the group, we have all the dentists, for instance, in Spain, are members of the ENSP through the Spanish Dental Association, who is member of the National Committee of Tobacco Prevention. But we have two dental associations that are fully members of ENSP, and I want I appreciate very much that, and I am grateful. And one is the next speaker is the president of the Colegio de Dentistas de Tenerife, and the second one is the president of the foundation, the Canarian Dental Foundation, that is the Dr. Cabrera. So that's also the reason they are here today, because they are full members of ENSP, and they are also active members of our working group on tobacco and oral health. So thank you, both of you. Thank you. And now I want to give the floor to another example of different type of dentists. And in this case is Dr. Pereira. Dr. Pereira is a very well known dentist in Tenerife, in the island where I live. He's the president of the Royal Academy of Medicine in the islands, of the Canary Islands, but he's the president of a very small dental association in one island. It's a province with 4 islands, but the capital is Tenerife. And he can give us the impression from his point of view as president of a group of a reduced number of dentists that he is leading in our islands. The floor is yours, Francisco.
Thank you so much, Dr. Rodriguez Lozano, for inviting us, for inviting me to this meeting. And as president of 50% of the dentists of the Canary Islands, I want to congratulate you for the document that you have developed. In my opinion, it is brilliant. In the islands, we have a study group founded in 1989 that organizes causes and congresses, keeping our members perfectly actualized, even living so far from mainland Spain. We have almost 100 members, and actually I can say that it is almost an 100 free smoking group. We dentists have to make our health authorities understand that we are in a strategic situation to collaborate in the fight against tobacco. Our proximity to the patient and the serious injuries that tobacco causes to the oral health give us a position of privilege to convince them to quit smoking. Thus, the battle against tobacco smoking needs necessarily from the dentist if we want to win this war. Thank you so much for your attention.
Thank you very much, Francisco. Now we have the pleasure to count with another member of the group, that is Dr. Biljana Kilibarda. She comes from Serbia. She is a very active member of the group, and she's a very active member of ENSP from a long time ago. She's a dentist, but in fact, she is now the responsible of tobacco in the Public Health Institute of Serbia. So she works in tobacco control directly, but she is a dentist. She studied dentistry, and for us, we are very proud of having dentists also in these positions. So the floor is yours, Viviana.
Thank you very much for the invitation, for cooperation, and for everything. Basically, as Dr. Francisco introduced, yes, I finished I'm Doctor of Dental Medicine, but I'm mostly involved in public health, so I'm not practitioner. And as public health professional with PhD in addiction, which also suits this nicotine addiction, in my career, I had opportunity to work in different fields. In the last 10 years, I'm mostly focused on tobacco control, but this does not exclude other issues. And from this perspective, I'm always thinking, I'm aware of the public health consequences. We follow this and collect data from the public health perspective, but in this role, we often witness how difficult is and challenging is to implement a recommendation into the system, which is our final aim. Very often we are in the position that we get for example, some recommendation which what should be done, but in the real life it is not that easy. So basically, we can maybe later discuss on possible opportunities, tasks, and what we can done, and what are the barriers to move this, especially in countries with different systems, you know. So maybe later I will also give some suggestion and some views how this group and other groups and organization and WHO can contribute, so we can also achieve a higher involvement of dentists into the practice of tobacco control, mostly cessation, which I find challenging from different perspectives. So thank you again.
Thank you, Iliana. Thank you very much. Well, another member of the group is Vegeta Emmar. Vegeta Emmar comes from Sweden. She's an oral hygienist, and she's a great example of how all the members of the oral health community, of the dental team, must participate in this fight against tobacco industry and against tobacco consumption. She's very well known in Sweden because she's very active. She's always pushing. She's very, very active. She's pushing also in the working group. She works as oral hygienist, but she is also representative of the dental profession, of the professions or the professionals in Sweden. And so I would like very much to offer the floor and to say some words, please.
Yes, I'm going to say some words about my view in the tobacco work. I've been on the field for a very long time, and I have practiced a lot in tobacco prevention. And the dental team, we talk a lot about that in Sweden. The task of the dental team is to improve dental health and smooth out an evenly distributed dental health. The dental team also has a great opportunity to help children and adolescents to never start using tobacco. That is what we talk a lot about in Sweden, because in Sweden, all the kids are coming to our practice and examining their teeth. And when they come, we always talk about tobacco. The dental team asks everyone about tobacco use from the age of 12. The dental care team conducts a brief consultative talk on tobacco, and we use the model of 5A, as some of you talked earlier about. And we know that just to ask on tobacco use has an impact. So that is very important. The dentistry now refers much of the tobacco cessation to health center and quit smoking line. But the tobacco cessation in dental care is performed by dental hygienists in a few places in Sweden, so it can be developed much more. Then we do a lot when it comes to children. I'm going to give you some examples for our interventions. We carry out oral health informations in preschools and schools, which always addresses tobacco use. We do that in every school, so that is very, very good. We then inform about the harmful effects, both in the mouth and in the body, but we also talk a lot about child labor and the environmental impact. Just to talk about child labor gets the students, they say now they don't want to start smoke because they don't want child labor. Dental hygienists are included in the work with tobacco-free duo, which is a contract method that prevents children and young people from starting with tobacco in any form. There's currently the important just now is not just talk about cigarettes to young people, as we all have spoken about, but to also address the new nicotine products that are now widely distributed in this group. And now there's currently a great deal of ignorance among both children and adults among these products. for example, of new products in Sweden, white snuff, you know, we have snuff in Sweden, has increased in a few years from 7% to 19% at the age of 14 to 18 years. And 73% of all pupils have tested electronic cigarettes in high school. So the new products is become more and more common among children. So we can do a lot. We can do a lot, both to adults and to children. Thank you.
Thank you very much, Vegeta. And following with the members of the group, now I would like to give the floor to a professor of university, a dentist, Dr. Martin, who from the beginning was in the first meeting in Bucharest. You have seen her in the slides I presented. She is very active. She is professor in Madrid, in a university, in a faculty of dentistry. So I give the floor to Dr. Martin Carreras.
Yes, now I think you can hear me. Thank you very much, Professor Lozano, for your kind invitation, and I would like to thank all of you for your participation in this meeting. It's been very interesting, and I'm going to pass my slides very fast because everything I have written you have already said, has been already said. So let's move on to the part which I think is more interesting. And of course, I agree with Professor Landi that maybe we cannot access very easily legislators, but well, let's go on to the basis. We at university can do. There is a lot to do. We can do many things. And in this direction, Dr. Lozano and I have come with an idea that maybe taking into account the effect of these ethics on oral and systemic health, we could improve or we could promote on one side research projects and maybe promote the publication of reviews, and maybe we could perform together some articles in order to make not only the population but also the dentists and the healthcare providers, including dental hygienists and assistants, about these topics that we are talking today. And also, I think that we could include more information for young adults about the systemic effects of these habits, not only the ones that include tobacco, but also the fact that they share these shishas and hookahs without unknown products, that we don't know what the components of these liquids are in many occasions, in many cases. So the effects on oral health of these electronic devices are already said, so we are going to pass very fast. And I just wanted to mention that we published an article. We studied two populations. One was at UCLA, the University of California, Los Angeles, and the other one was European University of Madrid. And the conclusions of our research work were that there were gaps in tobacco related with our university education. And since this prevalence of e-cig use is likely to continue to increase, it is imperative that dental students in all universities are able to counsel their patients regarding the potential adverse effects of e-cigs usage and advocate alternative means of cessation therapy. So in this direction, Dr. Lozano and I have come with a conclusion and with an idea that maybe we could promote or design a campaign together, the members of NSP, of course, and the FDI, the CED, and the WHO, maybe taking into account that the Day Without Tobacco, or which is going to take place on May the 31st, maybe in that week we could promote a campaign between universities, open to many universities or all the universities worldwide, and maybe we could like launch a contest of an activity that could be useful in order to help people be concerned about these effects that we know. So even though literature is scarce, we know that this is not a good habit. So maybe we could prevent, or we could give information to our healthcare providers, colleagues, and we could first of all launch a contest or give videos or brochures to universities so that they can during that week held educational activities on tobacco cessation. And I think this can be possible if we provide them with these sources. So if we go to the basis, maybe university teachers can get involved in this final objective that we all have. How about that? What do you think about that? That's my idea. And I think that maybe this is the appropriate moment to discuss it. Of course, Dr. Lozano, as president of ENSP, can discuss the details with all of you. But I think it could be a good idea. Why not? We can do a lot.
Thank you, Carmen. Of course, this is the spirit, the fresh air that I like to have in this working group. I think, well, we will finish with the presentation, and maybe in the final discussion we can talk about that, because of course this is the excellent part. We have the president-elect of the TI, we have the representative of the WHO, you have the president of all the European dentists here, Dr. Orlandi. So you are in the best moment to say, and you are the best opportunity. So we can discuss after about this, because I think it's a great idea. I'm very proud of the members of this working group. Thank you very much. Thank you very much. Well, let me give the floor to another member of the group, is Dr. Luis Moreno. He represents a scientific society. He is the secretary of the Spanish Society of Oral Medicine. Let me say also and apologize the presence of another society that it had to be today, but by a last-minute problem, they are not here. It was the Spanish Society of Oral Surgery. They are having also active members of this working group. But I think Dr. Moreno can give us the impression as a dentist, but working in a scientific society, very well recognized and very well appreciated in Spain. So yours the floor, Dr. Moreno.
Thank you, Dr. Lozano. First of all, I have to apologize because, well, you have seen I have had many problems this morning with the power supply at home. So I want to be here, I want to participate, and I have to be outside. Well, thank you, Dr. Lozano. Yes, I know very well the Surgery Society, the Spanish of Oral Surgery, and they have worked and sometimes with us in many programs. So I think we can speak of all the scientific societies working in this subject. Well, I don't want to be many time here, too much time here, because there have been relevant information about associated pathologies with tobacco consumption, the importance of attitudes of dental team on tobacco cessation programs, but I would like to point in 4 different important issues about the role of scientific societies. The first one is that we are doing now educational programs with universities in order to complement, we don't want to change the curricula, but we want to complement the curricula in the university. The second one is the collaboration with health authorities. And we have done now in Spain with the Ministry of Health in some brochures or papers that they have published about the cessation of tobacco consumption. The third one is implement continuous formation activities. We have the Spanish Society of Oral Medicine, and not only us, but many Spanish society and European societies have continuous formations activities in order to promote the attitude of the dental team in tobacco cessation programs. And the last one is the collaboration with organizations as ENSP. As Dr. Martin Carrera said, we have a lot to do, and we can do a lot in this issue. So yes, the Spanish Society of Oral Medicine will participate in this activity or in the future activities we could think. That's all. I think there are some points we are working on. There are some we can work in the future, but we have many things to do together. Thank you very much, Dr. Lozano, and all the participants for your work, and hope to see you in person someday. Thank you very much.
Thank you, Luis. And maybe Hani, do you want to cancel? We have a space for a short discussion, or but allow me just to say a word. I want to thank you from my heart to all the members of the group, the participation. I think in a short period of time and with all these problems, we have done things, and the example is today. I want to thank you especially to a person that from the Scientific Society of the ENSP from the beginning was helping, and it has been a great help for the group, is Professor Ayesta. All of you know him. He was a big support of our group. I want to express my gratitude and all of the group. And I want today to express my gratitude also to all the speakers, and of course to Professor Elena Stoffi, because she has made a brilliant presentation on oral cancer. I want to thank you also. She extended the invitation to some colleagues from Harvard University that are hearing us today, and thank you very much. I want to say that we have also a very special person attending, that is Professor Hanyoku from the University of Fukuoka from Japan, that he has come to our meetings in ENSP in the past, and he was very interested. He's a dentist, he's professor in the Fukuoka Dental College, and he's also attending here. Thank you very much to all of us. Thank you, of course, to the speakers that are representing institutions. Thank you, Marco. Thank you very much for the great support from the Council of European Dentists. I was the vice president in the past. I am very proud of this organization. And thank you very much for being there. Thank you also to the FDI. I was also very involved in the FDI in the past. I was the liaison officer from Spain for several years. I attended many meetings of the FDI. I was the correspondent of your magazine FDA News for Spain for a long time. So thank you very much for the commitment of your institutions. And of course, thank you, why not, of course, to the WHO. All of us have the WHO in mind. I'm very happy having here the support and the participation of the responsible of oral health in the WHO. Thank you to all of you. And going to the next step, as our active colleague, Dr. Martin has suggested, I think this is a new step that we can do. We will celebrate, we are celebrating now today, well, tomorrow, the World Oral Health, but now we have in the close future, the World No Tobacco Day, that is the 31st of May. And so an initiative from the group could be this that Dr. Martin is proposing now. I want to extend the invitation and to put in a compromise to the FDI, to the CED, and to the WHO. Well, I think this probably is not the moment to go in depth in this, but of course, if you allow us, we can go in that direction. Maybe Carmen can coordinate this and can put in communication with you and try to do something for this World No Tobacco Day in the sense of the universities with the cooperation of the FDI, the CED, and the WHO. And well, maybe we can give the floor to give some suggestions or to say something. Maybe Hani wants to summarize any of the things, or maybe some of you want to say something. We have, I think, 10 minutes until 3 in the Canary Islands, 4 in the rest of Europe. So now it's yours, the floor.
Yes, thank you very much, Francisco, and all our respected speakers and attendees. Actually, we had the questions. I received the question before the webinar, but I also received from the same people that all questions were answered to during the presentations. I don't think there's more questions at the moment to discuss. The suggestion by Carmen, it's on time, and you're really good using the time and the moment. So it's a very great idea, as was mentioned by Francisco also, and they really need to be planned very well. Also, of course, dental personnel have a major role to play in smoking prevention and smoking cessation, and also as Nsp, as we are working on tobacco cessation, we are always open to provide also support on tobacco cessation training or consultancy. So anytime we will be more than happy to help and support. I see Dr. Biljanas, you are raising your hand. I think you want to say something.
Yes, I forgot to say, or I kept time to say now. I was thinking about, we emphasize a lot the consequences to oral health and how important it is to have involvement of oral health professionals, but I'm thinking how to motivate them. So I think in that respect, it would be useful if we could find, later we can talk how to disseminate this, but how to find some example testimony of the dental practice that implement smoking cessation or short interventions, and how this contributed to the practice, because at the very end, at least in my countries, there are mutual barriers for both public and private dental offices, and this would be high smoking prevalence among health professionals, at least still in my country. But there are different barriers for private and public sector. For public sector, it would be lack of time and low motivation. So we would have to have some different approach. But for private practices, it would be maybe useful to help them or share, exchange experience how this can promote their offices, their dental clinics, to stand out that they're unique or they're pioneers in some ways. So I think this would be a motivating factor. And also, I don't know, because as I said, I apologize, I'm not a dental practitioner, but maybe for them, to motivate them, it would be useful to have some mutual statements on how tobacco reflects on some interventions. For example, implants. I know that, and it was mentioned that if somebody is smoking, it is not recommended, or it will have a lower success rate. So this kind of more practical information maybe could be something in the future we can also work on. And one more thing which I think is useful is, because I saw already that dentists are used to promote heated tobacco products. So maybe a statement which can be distributed through association, WHO, but constantly and frequently, could be shortly, you know, but constantly remind them and also use it as opportunity to stress the Article 5.3 within this. Also mapping barriers or something. I think that to conclude, there is so many opportunities and so many tasks we can work together, and I'm looking forward to cooperating with all of you, and thank you again.
Thank you, Liliana. I really appreciate what you are saying, because what I've learned in my last years of activities that well, I'm now the president of the ENSP, and the ENSP is Europe is very different. It's very various. It has nothing to see probably the northern countries from where comes Vegeta, that Serbia where you come, or Spain, or Italy, or Bulgaria. There are big differences, and in the dental field also there are different approaches to the dental treatments and the dental structure in the different countries. And Marco knows a lot about this. There are big differences, but we have a common. All of us has a common education in dentistry, and we have the same ideas. And in what Liliana just have said, I repeat what the former chief of the secretariat of the CPC said, that there was a conflict, an irreconcilable conflict of interest between the interest of the tobacco industry, the economical interest of the tobacco industry, and the interest of the health. Is our interest. We must be in that side. That's something very, very clear. That's something very clear. The WHO, it has very, very clear this fight. We must be in this side of the battle, and we will win this battle, because we are right. We have no money many times, but we are right, and that's essential. So I'm very happy having done this. Another thing that I want to mention here today is that this working group is open to everyone interested, to every dentist outside of the ENSP. We started the members of the ENSP, but of course we would like to be as wide as possible, mainly in the European field. That is where we are working. But of course we are very happy having this colleague from Japan and from the United States. So thank you very much. And I think that Marco wants to say something.
Yes, Marco, thank you very much. Just to say a few words about collaboration, because I've been always in favor of collaboration. I know also the difficulties of having different bodies collaborating on the same issue, and Paco, you know what I mean. I think the first thing I would like to say is that I really appreciate what Professor Carmen Martin has said about the role of academicians. And in that sense, I think that we could also involve ADE, so the Association of Dental Educators in Europe. And I know they don't represent all the dental universities in Europe, but it's important. We, as CD, has many collaborations. We have a permanent task force, common task force with ADE on professional qualification directive. And on this side, on the side of collaboration with FDI, CED has a common task force with ERO, the Regional Organization for Europe of FDI, and we had a fruitful collaboration, for example, on antimicrobial resistance in the past year. We had a common podcast that was broadcasted on AMR. So I think that there is the possibility of, merging different initiatives, keeping also the individuality of the different bodies. So every one of us has his own role and mission. I mentioned already that CD has the tradition of a meeting in the European Parliament about oral health, different aspects of oral health. We had a meeting on aging population, on oral cancer. I think that it's good to think about having this kind of meeting on tobacco prevention and cessation. So I think that every one of us with his own mission can have a different vision and perspective of what can be done. I think that it's fruitful to keep in touch and try to have a mutual organization on this kind of issue, mutual vision on what will be the final goal for every one of us. Thank you.
you. Thank you very much, Marco. I don't know if someone wants to add anything. Anyway, I would like to wish a happy World Oral Health to all of you, of course. And well, Hani, I don't know if you want to say something, or I don't know if there's no more questions, no more. Well.
Yes, just one. We have one intervention from Larissa. She was very active during the webinar with questions and comments. So Larissa, please, you can say something.
Yeah, hi everybody. As a dentist myself, and I've been working in tobacco control for the past 10 years, I found it a very big motivation if I tell the patient that the bleaching and aesthetic part of dentistry will be totally wasted financially if they continue to smoke. So I found this as a major motivation for the patients to quit smoking, or at least reduce the amount of tobacco use when they want to do aesthetic dentistry. So I just wanted to add this, that this could be something that we could use as a trigger point, like my colleague from Serbia said, that we need to motivate patients.
Thank you, Larissa.
You're welcome.
Well, so Hani, I think we can finish.
Yes.
Of course, I want to say that this event in the Parliament will be held someday. I don't know when we will celebrate it. And by the way, Marco, AD was invited to this event in the Parliament, and they have confirmed. Today they are not here, but because it's impossible to have everyone, but they are in contact. They're in touch with ENSP, and we are working together. So for me, it's great to have also all the institutions today here with dentists. For me, it's great that at least I'm seeing dentists working on tobacco. Sometimes it's difficult. Maybe I was too pessimistic in the beginning, but that's what I've been feeling for a long time. But now I'm happy because I'm seeing this is changing, and it's logic. It sounds very logic because we are working every day with the problems of the tobacco in the mouth. And I think we must be considered as part of our societies, of our environment, and I think we must be part of the decisions. Why not? We are health professionals and we are absolutely concerned about this. So thank you very much to all of you. Hani, do you want to close, please, the meeting?
Yes, I think you already did, Francisco. So thank you very much again for your kind accept our invitation and your kind participation and your valuable intervention and presentations during this webinar. Of course, this is the beginning of our new collaboration to continue our work on this direction. So I think we will communicate soon for more campaigns, more plans, future plans all together. Thank you very much, and we hope we'll see you soon in person, not online only.
Thank you very much. I want to confirm, I see Cornel there. Cornel, we will have this in the YouTube channel of the ENSP, I think. Yes, this webinar.
Hello. Yes, if everyone agrees, this is not a problem. The meeting was recorded. We just need the agreement, your agreement.
Thank you very much. Thank you, and again, happy World Oral Health Day. Bye.
Bye. Bye. Bye.
Bye.